everyone, my name is Midwife Sally. Welcome to my channel. Today we are going to look at pre-eclampsia. Okay, so what about pre-eclampsia? I want to help you identify the signs and symptoms that you may be developing pre-eclampsia or pregnancy-induced hypertension. Yes, we know that in Africa it is one of the leading causes of maternal deaths. So it is a must know for every mom. Okay, so if you are pregnant, this is a great opportunity for you to know what it takes to have pre-eclampsia. If you are not pregnant, please have this knowledge, yes, and keep it until you are pregnant. If you have a friend or a sister who needs to watch this, call her to watch it. Okay, so in our local setting, we have a lot of people who will tell you, oh, I have swollen hands and feet. They will interpret it to you as a sign of having twin gestation. Okay, so recently, I nearly lost my sister because of pre-eclampsia. She has swollen hands and feet, but she never had any high BP, she never had headache, she never had anything at all, just the swollen hands and feet. Yes, so what I am saying is that if you have swollen hands and feet, don't sit and think that it could just be a sign that you're having twin gestation or you're going to give birth to a male child. Don't get it wrong. It could be a sign of pre-eclampsia. Go to the hospital, report for further investigations. Yes, there was a lady who also walked down the street and was thinking that she was having just severe headache. She walked down the street and to buy paracetamol. After buying the paracetamol, she didn't even get home. She fell on the floor and she opened her eyes on the hospital bed. Yes, that is how dangerous pre-eclampsia can be. So if you are pregnant and you have severe headache, you don't wait. Yes, you don't wait until it gets worse. Make sure whatever you are doing, you put a stop to it, you rest a little, and you report immediately, and you check your BP as well. Yes, so far I have mentioned two things, having severe headache and also swollen hands and feet. For some people, they have palpitation. So palpitation is you feel that your chest is beating. Okay, so on a normal person, we don't feel it when our heart beats. But if you are pregnant, sometimes it does happen. But if it is continuous and it is excessive, you want to check your BP. You want to make sure that everything is on point. Okay, so there is a lot of things that can contribute to having high blood pressure. The cause is unknown, but these are the things that you should look out for. Okay, so if you've gone to the hospital and your BP is checked and it is above 120/80 milligrams of mercury, okay, so if it is above that, you should be alert. Yes, somebody will say, okay, when I went, my BP was 90/60. Okay, so once it is increasing, everybody should take note of your first BP. So when there is a change, you should realize that there could be a problem. Yes, there could be a problem. And you need to pay attention to the BP. So all of a sudden, if I'm jumping from 90/60 to 120/80, though 120/80 is still normal, it may not be normal for me. It may not be normal for me, yes, just because I didn't start from that point. Yes, for some people, you also get visual disturbances, you get epigastric pain. Okay, so in Chi, they say it's oboshisho, like you feel that epigastric pain. Yeah, so if you have, or you feel dizzy, this could all be signs that you could be having pre-eclampsia or your BP is going up and all that. Yes, so in this video, the main point is to highlight the signs and symptoms of pre-eclampsia and eclampsia. So we have high blood pressure. When you go to the hospital, they have protein in urine. You may also have visual disturbances, okay, and upper abdominal pain. So you can have abdominal pain in the upper parts of your abdomen, okay. So before you get there is a severe form of pre-eclampsia, which we call eclampsia. In eclampsia, just like I told you, the woman just fell down on the floor and that was it. It can also happen that way, and it's like an epileptic fit. So in eclampsia, At that time, you would have fainted, you may have lost consciousness, everybody is rushing. And so you have to report your symptoms very, very early. If you're having headache, severe headache, persistent headache, report. If you're having swollen hands and feet, report. If all of a sudden your BP is shooting up, report. You're having visual disturbances, epigastric pain, it could mean that your symptoms are getting worse. Okay, so this is where I'll end it today. Make sure you join our class to know how you can manage it, what you can do, the steps you can take to avoid all these problems. It is possible to avoid all these problems. So know your symptoms, take actions as soon as possible, and join us so that you have a one-on-one interaction with our midwives as well. And then many of the tips I've taken is from Sally's Tips from Expectant Moms, which you can get on Amazon and also get a hard copy from us. All you have to do is to send us a message and we'll get one for you. Thank you. My name is Midwife Sally. Follow us on Facebook, Instagram, and don't forget to subscribe to our YouTube channel. Thank you. Bye.